Okay, so today we are going to study the tricuspid valve disease, and here we'll know about the various tricuspid valve disease. So let us know what is tricuspid valve first. Here, the question is, where is tricuspid valve located? So in this image, which is the image of the heart chamber, where this is the right atrium, this is the right ventricle, and this is the left atrium, and this is left ventricles. So there are four chambers present in the heart. So tricuspid valve is a label here. So it's present between right atrium and the right ventricle. Okay. We studied about the mitral valve disease also. So this mitral valve is a valve which is present between the left atrium and the left ventricle. Okay. So we are going to know the disease of this tricuspid valve. Okay. So where is tricuspid valve located? So we can answer that location is between the right atrium and then right ventricle. Okay. So next, what is tricuspid valve? So if the question is asked, what is tricuspid valve? So we can say tricuspid valve flows blood from the right atrium to the left ventricle. So this is the valve, the opening or the door we can say, which allow to flow the blood from right atrium to right ventricles. This is the direction that is this is what the flow of direction of the blood. Okay, right. So this is the direction of the flow of blood from right atrium to the right ventricle, and this is what the regulated by tricuspid valve. Okay, and tricuspid valve also prevents backflow of the blood into the right auricle. So right auricle or right atrium. So here what do we say, this valve also prevents the backflow of what we say, which is not a normal condition. Okay, there is the blood flow is always followed from one direction. It's a right atrium to the right ventricle. But what happens in abnormal condition, there is a backflow of the blood, that is what from right ventricle to the right atrium. So this is the abnormal condition where the disorder occurs when there is a abnormalities of tricuspid valve actually. So normally tricuspid valve, what it does, it prevents backflow of the blood into the right atrium. Okay. Next is, what are the types of tricuspid valve disease? So we are going to know that various types of tricuspid valve disease which are experienced by the people throughout the world. First one is the tricuspid valve regurgitation. Second, tricuspid valve stenosis. Third, tricuspid atresia. And the fourth one is the Ebstein's anomaly. So there are four types of tricuspid valve disease we are going to understand today. Let's know about what is tricuspid valve regurgitation. Okay. Here in this image, it has shown that this is the right atrium and this is the right ventricle, and this is the what it has shown the right tricuspid valve. Okay, this one. Now this is the normal pattern of the blood flow. Here the blood is flowed from right atrium to the right ventricle through this tricuspid valve, which is the normal. But there is a abnormalities in tricuspid valve. This this is what we can see. There is a backflow of the blood. Okay, so malfunctioning of tricuspid valve allows backflow of the blood into right atrium from the right ventricle. Okay, this is what happens. So this is called regurgitation. We can say that this is the condition in which the tricuspid valve doesn't close properly. Okay, when the tricuspid valve doesn't close properly, so what happens when the blood once goes to the this right ventricle, again because of inappropriate closing of this tricuspid valve, so the blood leaks back and it comes back into the right atrium here, and here blood flows back into the right atrium. Okay, so the two things happens. The tricuspid valve doesn't close properly, and because of that the blood flows back into the right atrium. Okay, so this is the what events takes place in the tricuspid valve regurgitation. यहाँ पे क्या होता है कि ट्राइकस्पिड बल्ब रिगर्जिटेशन में ट्राइकस्पिड बल्ब क्लोज बढ़िया से नहीं होता है, ये क्लोज हो गया है, एक बार ब्लड यहाँ से वहां चला गया राइट वेंट्रिकल में, तो दोबारा से बैक नहीं होगा। लेकिन जब एबनॉर्मलिटीज में देखिए क्या है, जब ब्लड फ्लो हो जाता है तो दोबारा से बैक हो रहा है यहाँ पे। Okay, so here the first event is the tricuspid valve doesn't close properly, and because of that, the blood flows back into the right atrium. Okay, this is called as a tricuspid valve regurgitation. More than 10 lakh cases per year in India. So here, this kind of abnormalities are observed in India every year, around more than 10 lakh cases. And this condition is what require urgent medical attention when there is a severe cases. Otherwise, there will be the death of the patient. Next, what are the symptoms if there is a tricuspid valve regurgitation? So the fatigue is a very common symptoms. So these are the symptoms we are going to know is a common symptoms experienced by many patients suffering from tricuspid valve regurgitation. Abdominal swelling, abnormal heart rhythm, neck pulsing, shortness of breath during activity. So these are what the common symptoms, okay, which are experienced by the patient suffering from tricuspid regurgitation. And the symptoms may vary depending upon the severity of the condition. So this is what happens. The symptoms which are seen here or mentioned here, so it may can vary depending upon the severity of the disease. What are the causes of tricuspid valve regurgitation? What are the causes? So it can be the congenital disorder, because it's a kind of congenital which is by birth there is a defect. Okay, so which leads to the abnormal development of tricuspid valve. So tricuspid valve which are supposed to develop in normal way, so it is not developed in normal way. So there is abnormal development, and this development which is abnormal is a by birth abnormalities, which is called as a congenital disorder. Enlargement of right ventricle. So when there is an enlargement of right ventricle, so in such cases also this kind of condition arises. Damage to the valve due to infection in the inner lining of the heart. So the infection in the inner lining of the heart may can damage to this tricuspid valve, and this leads to regurgitation process. Damage caused by implantable devices. So when some devices are implanted in the heart, okay, because of the procedure in the treatment, so the implantable or implanted devices also can cause damage to the this tricuspid valve also, and this leads to regurgitation process. So these are the the different causes, okay, recorded causes which leads to the tricuspid valve regurgitation development. Diagnostic test and procedure. That which diagnostic test and procedure can be done to confirm or diagnose the tricuspid valve regurgitation. So here the first echocardiogram, which detects the tricuspid valve regurgitation. It can detect the condition of this regurgitation process. Cardiac MRI can also be done to detect severity of the condition, and the X-ray, chest X-ray is taken to evaluate the shape of the heart and its effect on the lungs. So these are the tests and procedure which are suggested to to manage, to diagnose, to manage, and to see the effect of the treatment on the patient. What are the treatment? What are the suggested treatment for this regurgitation? So medication can be one of the first priority, where diuretics are usually prescribed. Diuretics are the medicine which prevent water retention in the body, and this example of the diuretics are chlorothiazide, bumetanide, and amiloride. So these are the diuretics medicine which can be given to the patient. Some treatment procedures which involve is heart valve repair, which restructure the heart valve, and next is a replacement, tricuspid replacement, where damaged valve is replaced with a metal valve. And the third procedure can be done is a annuloplasty, which where we insert metal ring to support valve. So there are three procedures can be done in the treatment, okay, and we can prevent uh, the valve regurgitation. Nutrition can also be one of the factor which helps in the management of the disease, like foods that to eat. So the suggested food which should be taken are like the foods low in saturated fats and sugar. So foods low in saturated fats and sugars are advised to take, whereas foods which are should be avoided are high salt intake of food, okay, excessive fluid intake and intake of alcohol. So high salt, high excessive fluid and intake of alcohol are avoided uh, during the when there is a patient suffering from tricuspid valve regurgitation. So next disorder is a tricuspid valve stenosis. Here we are going to know that how this what is the meaning of this disorder. Here we can see the image. This is the normal heart, where we can see the flow of the blood from right atrium to the right ventricle, right? So this flow is being taken place through the this tricuspid valve here, which is normal, which is open properly. But what happens? This tricuspid valve here, which becomes narrow. So narrow valve causes increased restriction of blood flow through the valve. So blood will not be able to flow from this right atrium to the right ventricle. So there is a restriction of the blood flow. Okay, since the valve has turned into the narrow valve. Okay, so we can say now in this condition the tricuspid valve is narrowed. The first thing is the valve becomes narrow, and the second thing, the amount of blood which flows from right atrium to the right ventricle, it decreases. Okay, so the right ventricle gets very less amount of blood. Okay, so this condition is called as a tricuspid valve stenosis. What are the common symptoms? So lethargy is the first common symptoms. Tiredness, weakness, cold skin caused by low cardiac output because the ventricles never gets sufficient amount of blood, and because of that there is a cold skin, and irregular rapid heartbeats. So the heartbeat is always irregular. Quivering, or what we say vibrating sensation in the neck. So in the neck there is a sensation which is something vibrating sensation you can see in the neck. Intense pain on the upper right portion of the abdomen, likely caused by the congested and enlarged liver. So there may be the enlarged or congested liver, which leads to the intense pain in the abdomen. Okay, which we can feel at the upper right portion of the abdomen. Shortness of breath. So the breathing will be very short, and swollen abdomen or legs. So these are the common symptoms, and we can see that the dilated skull veins here. Okay, in the image. So this is what the veins we can see in the scalp area. Okay, so which are dilated and which can be visible from the outside. So these are the common symptoms which can be seen when the patient is suffering from tricuspid valve stenosis. What is the causes of tricuspid valve stenosis? Here, rheumatic disease is the first, where there is an infection. Carcinoid syndrome, so something like carcinoma-like syndrome. And then the third is the pacemaker leads. So when we pacemaker is something which is a device, okay, which may be inserted in order to stimulate a faster heart rate when the heart rate is beating too slowly. So when the when heartbeat is slow, so in order to enhance the heartbeat, to make the heartbeat more faster, a pacemaker device is inserted in the heart, which stimulate the heart to beat very faster. So the leads of the pacemaker can cause the complication and leads to the tricuspid valve stenosis. What are the diagnoses for tricuspid valve stenosis? So it's a mild diastolic murmur. So this is the sound which can be heard during the auscultation process. Okay, caused by the which is caused by the blood flow through the stenotic valve. So stenotic valve, when the tricuspid valve becomes stenotic, so the blood flow uh, is abnormal, and this abnormal blood flow produces murmur sounds which can be heard during the auscultation. Auscultation is something like listening to the internal sounds of the body using stethoscope. So when we hear the sound of some internal sounds using the stethoscope, so that procedure is known as auscultation procedure. Okay, and we can see the murmur sound. Diastolic murmur sound can be heard. So this is the first screening process. The second, which is a confirmatory test, that is the echocardiography. The diagnosis is confirmed by an echocardiograph obtained from the echocardiography, and this echocardiograph allow the physician to assess its severity. So this is the diagnosis for tricuspid valve stenosis. What is the treatment for this stenosis? So if stenosis is mild, okay, so monitoring the condition is sufficient. So we can monitor the condition by giving medication, by changing the lifestyle, changing the dietary intake. Okay, but when the stenosis is severe, then it may require surgical repair or replacement of the valve. So the treatment is usually by surgery, that is a tricuspid valve replacement, or another possible treatment is percutaneous balloon valvuloplasty. Okay, valvuloplasty. So percutaneous balloon valvuloplasty is another treatment. Okay, for the tricuspid valve stenosis. The third disorder, which is related to the tricuspid valve disease, is tricuspid atresia. What is tricuspid atresia? Here, tricuspid atresia is a condition present at birth. So it's a congenital defect. The tricuspid valve isn't formed. In this atresia, where tricuspid valve is not formed actually. Okay, so the patient is having right atrium and right ventricle without tricuspid valve. Okay, there is no formation of tricuspid valve from by birth. A solid sheet of tissue blocks the blood flow between right heart and chamber, between the right heart chambers. So this is what usually in place of the right cuspid valve, there is a solid sheet of tissue, okay, which is available in place of the right cuspid valve, and this solid sheet of tissue blocks the blood flow between the right heart chambers. So this is what the abnormal in place of this one tricuspid valve. This is what present from the birth. Abstain anomaly. Abstinence anomaly is a again congenital heart defect, and the tricuspid valve is formed abnormally. Here the tricuspid is formed, but it is formed abnormally here, and causes blood to flow back into the right atrium. So this is a typical condition similar to tricuspid valve regurgitation, and this tricuspid valve regurgitation disease is a congenital heart defect. Okay, where by birth the tricuspid valve is formed abnormally. So this is what we have studied, and we have come to the end of the slide. Now the time it's a time for the question. Please ask question if you have.